Welcome everyone to our human health themed career panel. This is one in a series of several career panels designed to introduce students to lots of career pathways that are available to them. This program is offered to you by Career Connect Southwest, which is a program of ESD 112. I'm Vicki Herdina, Executive Director of Career Connect Southwest, and we want to thank you for your time to listen to our panelists today. It's an amazing lineup. And thank you to all the middle and high school students that submitted questions in advance. So for now, I'm going to turn it over to our moderator, Sue Bluestein, and she's going to take it from here. Sue?
All right, thanks, Vicki. So what we're going to do is I'm going to have each of the panelists introduce themselves, tell us what career they have right now, and just maybe something personal outside of work, just so we can get to know you as a person. So I'm going to start with Saskia.
Okay. Hi, everybody. My name is Saskia Vanbergen. I work at the Washington State Department of Ecology, which is the state environmental department. And I'm the green chemistry scientist there, which is basically the science of safer chemistry. So really trying to encourage safer chemistry, having the chemists design safer molecules, so therefore there aren't hazards that can cause negative health effects to humans. And I guess the random piece of information, what I like to do outside of work is I really love to kayak.
Awesome, thank you. Dr. Gonzalez?
Yes, hi. So I am currently a psychiatrist and I have a private practice and also provide medical services at local hospitals as a consultant on the medical floors, and also I provide service in the inpatient psychiatric units. As far as what I like to do in my time off, I like to go boating and enjoying time with family.
Awesome, thank you. Kathy?
Hi, my name's Kathy Kaler. I am a mastered prepared registered nurse. My career path has taken many different turns. In nursing, you can do a lot of different things. So I started working in a labor and delivery unit downtown Chicago. Then I got married and I moved and I worked in a cardiac medical ICU. Did that for about 8 years. Then I worked in the emergency room for about 15 years. And then I went to the surgery area, the peri-op area is what we call it. Went into management, did that for a few years. And now I work for an electrician company. I'm not in the hospital anymore. And I'm doing occupational health. So completely different. But fun fact about me, I have 2 boys and I just love spending time with my family. We hike and pretty outdoorsy. Thank you.
Thank you.
So my name is Logan Kaiser and I have been a nurse for 24 years now, and very similar to Kathy, I've worked in all different types of places. The last 11 years I worked in management, and I have a master's degree in clinical nurse leadership and hospital administration. And now I am actually working for a construction company, and I'm the director of our health and safety programs, and we have about 500 employees, and we're a self-insured group, so I oversee all of our health insurance and occupational health and human resources and payroll, and it's a whole different twist to nursing that almost feels like a hobby. So it's great, all the paths you can go down in healthcare. Oh, there's a little side thing about me. I have 8 boys. 8 boys. All my wife and I, not hers and our, they're all ours. And now I actually have 3 granddaughters and a grandson as well. So I know I look pretty young to have all that, but anyways, so yeah, I love spending time with my family and outdoors and whatnot.
Right. Thank you. Summer.
Hi, my name is Dr. Summer Decker. I actually started out my training in anthropology. I started out as a forensic anthropologist, and I got my undergraduate and master's at the University of Nevada, Las Vegas in that, and specialized doing autopsies for the Las Vegas Coroner's Office before heading off to medical school, where I trained and completed a PhD in medicine, specializing in pathology and postmortem imaging. And I'm currently the vice chair of radiology at the University of South Florida College of Medicine, here in beautiful Tampa, Florida, and I am sitting right now in Tampa General Hospital. I also head up the 3D Clinical Applications Division, which means my team is in charge of all of the 3D modeling and 3D printing for the hospital and a number of hospitals around the country. And we also have been working really heavy in COVID with, we are the team that invented the 3D printed nasal swab that's being used across the country right now for the COVID testing. So that's why I look so tired and and trying to hang in there. We've been here as of the calendar on the wall, 80 days with only 4 days off.
Wow.
So,
Wow.
fun thing I do, I don't actually get to do a lot of fun things lately right now, but I love paddleboarding out in Tampa Bay with my dog. We love paddleboarding out together and watching the dolphins and manatees swim by. So thank you for having me.
Thank you. So our first question, just a little bit about what is it like, you know, in your job, what would a typical day look like?
So when I worked in the hospital, what I found is that every day was unpredictable. And just when you would think you were having a nice, smooth and easy day, someone might, their heart might stop and you have to start doing CPR, or one of your patients might have a heart attack, or, I mean, it's a whirlwind of activities. And really, you have to be on your toes and be prepared for just about anything, especially when you're working in the ER. You never know what is going to walk through the door. It could be a drug overdose, it could be a gunshot wound, it could be a baby that has choked on something. It's all over the board, and you have to be prepared to take care of the situation in front of you.
I'd like to piggyback off of that. I work directly with the ER here at Tampa General, and our day, even this morning, we will all come in with an idea of who we have to take care of for the day, and something happens and all of that goes out the window. And so you really do have to be flexible, learn to pivot quickly. And the big thing for us in my field is teamwork. So a lot of times we do all the trauma cases. So we're the imaging, we're the team of radiologists that come in and do the imaging. So we will CT scan or MRI scan and then have to go very quickly and create 3D models and 3D prints and do that over a certain short time frame so that they can go to surgery and be repaired. So a case I had yesterday was a young man that was in a car crash and fractured most of his face. We had to reconstruct his face virtually and then hand that off to the surgeon so that they could save his face. So we often think we're doing one thing, and then a few minutes ago I got a case about a heart. So we'll be working on that this afternoon after I'm done with this.
I would say that in my case, it depends on what I'm doing for the day. But like if I'm at the office, I could be seeing a patient who is 65 years old. My next patient could be 13 years old. So there's a lot of variety as far as like the patient population I see and the different kinds of mental illness that I see from one patient to the other. But then I'm also working with outpatient providers, like in primary care, that I'm available to answering questions about how to, you know, manage a patient that they have in their office, and you know, they need some guidance as to what to do in order to stabilize that patient, or what next steps to take in order to make sure that that patient's going to be safe. And again, we have a multiple array of medical conditions, but I would say that that's pretty much most of my days. When I'm at the hospital, I'm going from the surgical floor to the medical floor doing consults. It could be somebody that was involved in a car accident. It could be somebody that unfortunately was very depressed to the point that they have to be monitored. And we could also be involved in cases where a patient has a lot of medical complications. And then as a psychiatrist, we come in and we can help determine, you know, what other etiologies could be going on with the brain, basically, to help the patient get better. So it's pretty fun, and it keeps you thinking all day long, pretty much. Yeah.
And I guess I would say, you know, I had my experience in the hospital, kind of like Logan mentioned, but now in the role I'm in right now, I'm more about preventative health and keeping people from being admitted to the hospital. And so it's a whole different type of nursing for me that I've only been doing this for a year, but I'm very much so enjoying it. It's nice to help people learn how to take care of their bodies and be more on the preventative side. So as an example, like last year we did biometric screening. We have about 500 employees as well. And we went out into their jobs and we tested them for cholesterol and their blood pressure. And then we could say, hey, you know, your blood pressure is a little bit high. You should visit your physician, and, you know, it might be weight loss, or we talk about the changes that they can do to bring their blood pressure down. So I'm kind of on the opposite side of working with people and trying to keep them healthy. So it's a kind of a different twist. I never imagined that I'd be outside of a hospital working, but it's been very rewarding.
Thank you very much. You know, one of the reasons for this panel is just for students to get to know what different careers exist, because a lot of times you just don't know what's out there. And so I think they'd be very interested to find out why you are passionate about what you do.
I really enjoy, you know, my last job was management, and this job is quite different. I'm back to dealing with people every day, and I really enjoy that interaction. And just like Logan was saying, it's very rewarding to be able to help someone, and once you figure out what the issues are, to help them figure out how to make it better. Dr. Gonzalez and I work together very closely, and she has really helped me as a valuable resource when I have a person who's struggling. And sometimes that's just situational. It's not a lifelong thing. It may be one thing is happening in their life right now, and they need a little extra support, and they need some instruction on coping mechanisms to get through. And so I love being able to have connections with people, help them through their issues, and then partner. Logan and I work together, Dr. Gonzalez and I work together on how to make things better for people. And I really enjoy that.
Mm-hmm. In my experience, what I love the most about my career is that, you know, a lot of people don't think of psychiatrists as really being, you know, life-changing, you know, careers from, you know, what other people tell me. But I like the fact that I can sit there with a teenager who cannot talk to anybody, who feels misunderstood, who cannot talk to anyone at school, who cannot talk to anyone at home. And for me to be their advocate, and in a way help them problem solve and be the one positive thing they have in their life many times, and help those kids, you know, move forward independently of whatever's going on in their chaotic environment at home, for example. Also, I like working with the primary care and other, you know, experts, because if someone has a mental illness like anxiety, depression, if they're not stable emotionally, they don't take care of their medical problems. They don't take their medications. Their blood pressure is like high, and, you know, you end up with a lot of complications from that. And we play an essential role in that. And I love how we can certainly, you know, affect people's lives and in a positive way.
The reason why I'm passionate about my job and green chemistry is that I really believe that green chemistry helps human health and environment. So, you know, previously, a lot of times I was interested in high school in chemistry and ceramics and field hockey. And I ended up going into the path as an analytical chemist, because frequently if you're interested in the environment, that's what you did. You looked for contaminants and say, oh, you know, there's pesticides that were used in the 70s that are in sediments. And then, you know, there's breakthrough of explosives that were put into unlined lagoons. And so a lot of times, you know, basically the chemist identifies it and says, hey, engineer, can you fix this? And so when I found out about green chemistry and the fact that the chemists could help design safer chemicals that are safer for human health and the environment, it was really impactful.
So what I feel passionate about is that one of the things, when I went to college, my field did not exist. 3D modeling, 3D printing, and healthcare was not a thing. I got laughed at so many times. As I mentioned, I started on anthropology, and in our field in anthropology, we often can't handle remains. It's how we actually will interact with bones, and often we can't do that many times over. So we would actually take scans of them, laser scans. And so I started thinking, like, here's a field over here where we're using this to help identify someone, but the medical community is not using that for out there to help patients. And I really felt strongly that they could help patients. And so that's what I've been able to do, is really help our field translate from some of the science fields that were using the same technology, but move it to clinical medicine. And I have like examples here where this is a lung, and we have a tumor in the lung. Here, this patient is a 30-year-old man, and he was told he was going to have his entire lung, that side of the lung, removed. But because we were able to create this print and put it in the hand of the surgeon, they realized that they only need to make one snip, and they didn't have to remove his entire lung. And we have other cases where we have a patient who had a hole in his heart, and they told his family that he had 0% chance of survival and only a 40% chance of survival if they tried an intervention. But because we could hand that to a surgeon in advance and they could practice, they could try their tools out, they knew exactly what size devices to use, we give them all of that in advance, and that patient is fine. He's walking around today.
I have a question from a student. How do you separate your personal life problems from your clients' problems? For example, do you worry about your clients and analyze their situation outside of work without meaning to? Do you take some of your clients' problems home with you?
So I can start. So that comes with maybe maturity as well. I think I struggled with that early on. I would end up thinking about some of the situations I was involved in, some of the cases where maybe the outcome was not good. But over time, I've had to really, like sometimes on my way home from work, I have to almost talk to myself to refocus and get rid of whatever's in my mind. So when I get home, I don't even have a job. I mean, that's how I want my mind to be. So it kind of sounds weird, but really, you have to work with your mind and train it to not think about and dwell on the stressful things that. I mean, healthcare is very stressful.
Yeah.
It can be a very stressful career, but you have to work on that and somehow whatever works for each individual person. But it's worked for me, and I can get home and I don't even talk about my day a lot of the time because I don't want to hash it back out and think about it again and start reliving it again. So it takes practice.
It sounds like also when you talked about your passion for what you do, there's a lot of good that outweighs some of those harder times.
Absolutely, absolutely. And those things I do take home. You know, the successes and the good stories and whatnot. It is fun to share that. But the negative pieces or the things that kind of affect me, I just have to leave that behind.
And, in my case, I agree with, Dr. Decker. So when I have a difficult case and I notice that it's very difficult for me to let go, I always have the opportunity to reach out to another colleague and discuss that with more than a few colleagues. And then they can help you by, telling you how they managed a certain, issue that came up with a patient in the past. And then that's how you learn through the years. You start building up coping skills, and that's just how you survive. Because I agree, if you don't take care of yourself and are stable to help someone else, then we can't help others. Yeah.
Kathy, did you want to add something?
Oh, I was just going to say, to piggyback off of that, stressful times and hard times is a part of life, right? So that happens with you, with your friends that have an issue, or you're going through, maybe a grandparent passed away, or it is a part of life. And so the coping mechanisms is very important. Like, what do you do to de-stress? For some people, it's their faith they rely on. Some people, like the doctor previous mentioned, they exercise. you just have to find what it is for you that you can do that helps you get through the harder times, because it's not just at work, it's going to be in your life, it's going to happen. So the sooner you can figure out what those strategies are, the better off you're going to be and the healthier you're going to be.
I just wanted to add the one other element is an example coping mechanism, and it's more just from like just stress of a situation where you just can't let it go, and it's iterating in your head over and over, and you can't sleep. And sometimes, you know, come up with new ideas. What I do is I try to write them down so that I know it's there, and then I can sleep and not have to constantly try to remind myself so I don't forget. And so that's just an example of one coping mechanism that I've done that has actually helped me sleep.
I do that too.
Yeah.
So our next question has to do with what path did you follow to get to where you are? Because a lot of times students don't know what they want to do as a career. So just hearing what other careers or things that led you to where you are now would be very interesting for the students to hear.
So I can start with that. So I basically always wanted to be a family medicine doctor since I was like age 8. So definitely since elementary school, I always loved anatomy, kind of like, you know, Dr. Decker, and everything. So I certainly pursued that through college, you know, medical school. I started a family medicine residency. And when I was doing family medicine, I realized that the way things are now, you know, as far as like the ability to spend enough time with a patient is not really there that much. So I felt like I wanted to connect more with the patient. And I realized that about 40% of the people that I was seeing had some kind of like depression, anxiety. And I was seeing that these patients with these issues were not managing their diabetes and things like that. And I felt like switching to a career in psychiatry where I could manage, you know, the emotional component, but also still be involved doing the medical aspect of things by being a medical consultant was the best of both worlds. So that just kind of made me see the light, basically. And then I switched, and that was okay because I learned, you know, a lot from doing, you know, family medicine, but I certainly don't regret choosing the career that I have now. But I agree, it's a I think with what Logan said earlier, it takes time as we go in our careers to figure out the path that we're going to take. Mm-hmm. And, you know, you need to be, you know, open to the fact that, hey, you know, maybe in a year from now, I'm going to be thinking differently, and that's okay. As long as it's helping you find the path that you need to take, that's how it goes.
Someone else like to share?
I think I touched a little bit about how I kind of had a different background before getting into what I do, but I think that's the thing I try to share with my students here at the medical school, and even undergrads and high school students that I talk to, is sometimes you think you're going down one path and you just don't realize there's another path up there waiting for you that you need to take. And that was what happened to me. If you had told me I'd ended up doing this, there's no way I couldn't predicted this. But I think it's being open to that, being open to new things. Maybe you have a skill set you think that's completely unrelated to your interest in medicine, but all of that does help. I loved film, and I wanted to maybe be in National Geographic one day and be filming for them. Well, now I do imaging, so I do a lot of filming. You know, we do a lot of stuff like that. So these skill sets that you pick up along the way, maybe you're talented at it. That's the kind of stuff that actually just adds to your portfolio of who you are as a person.
Saskia, you mentioned that green chemistry was a new field, right?
Yeah. So
can you tell us a little bit about your path from high school on?
Sure. Yeah. So basically, I you know, high school, I was interested in chemistry. I was interested in art, and I actually went to a small liberal arts school where I continued to play field hockey. That was kind of a theme throughout. But basically, I majored in chemistry, and you know, when it got close to graduation, I had no idea what I wanted to do. And so I remember talking to this guest speaker who came. He's like, "Well, where do you see yourself Next year, what are you doing? You're a senior. And I was like, I have no idea. And so then he's like, well, maybe it would help if you see, where do you see yourself in 5 years? And I had no idea. So all this was just stressful, right? And so then basically, I guess my suggestion is just to find something that interests you, because as Summer mentioned, you can always change your path, right? So I ended up working at a natural products company. And so I was a quality control chemist where I was just, testing the quality of different herbal supplements. And then I wanted to move to DC. And so I ended up working at the Naval Research Lab where I looked at a biosensor that detected explosives in groundwater for soil remediation. And then while taking classes, found out about a graduate program, which was a graduate group, very flexible, it was interdisciplinary. And so there I studied environmental chemistry and also took a few courses in toxicology, and then worked at a drinking water wastewater utility where I was working on testing the sediments of the San Francisco estuary on different contaminants in the sediments. And this is where, yet again, the engineers, they can design the solutions to these persistent bioaccumulative and toxic chemicals that are, in our environment. And while there, I found out about green chemistry. And so I guess this is also life's about trade-offs. And so in some ways, at that point in time, my partner moved up to Washington, and there weren't a lot of jobs at that point in time. And so in the end, I took a big risk, couldn't find any, career advancements. And so I actually ended up working at a more entry-level position, and I was there for about a year. But that also allowed me, because I thought my career was over, to have a child, and she is the light of my life. And so when she was 2 weeks old, I found out about this job as a newly created position as a green chemistry scientist. And, friends told me about it because I'd asked a whole bunch of people. I did informational interviews, like what, kind of like this, what is your job like? What are your days like? What are the things you like and hate? And really, I think in the end, my advice is find something that interests you. You can always change your path. And also you have a job. Frequently, it's not 100% set in stone, all 40 hours or 50 hours or however long the day is. Really, there's opportunities to add some creativity to it and to, learn more and develop skills that you can use in future jobs. And kind of career is just something that you continue to grow.
Can I add something that I really want to make sure I mention, since, we have middle schoolers and high schoolers listening to this. I see a lot of adolescents, and they do bring up, oh, I wish I could do this for a career, most of them, in healthcare. And they bring up the fact that it takes too long. It takes too long to go through school, and I'd rather do something just for like a few years than start working. I would say, please follow your passion, and you will realize that even though it takes you longer to reach your goal, your whole life is ahead of you. You want to wake up every morning wanting to go to work. You don't want to wake up every morning feeling like, gosh, I have to go do this job, right? So think of that, please.
Good advice.
Kathy, how about your path?
Well, I think it's kind of about exposure. So I started, I wasn't really sure. So I started as a nursing assistant, and that just gave me exposure to the medical field. But I would say, the newest trend actually in nursing is a second career. There are several people, male and female, it used to be a very female dominated profession, and it's no longer the case. It used to be women were nurses and men were doctors, and now it's pretty equal in both fields.
Mm-hmm.
There's a lot of, I don't think nursing's 50% males, but Logan, do you know, it's pretty high now. It's maybe
it definitely has increased.
It has increased. But the new trend in nursing is people who have had other careers are now going back to school to get into the medical field. Like I have a friend, she was an attorney, and now she's a nurse. I know a orthopedic surgeon who started out as a construction worker, and he did construction for 7 years. And then he decided he wanted to go to medical school. My own son went to school for engineering, and now he's decided, after sitting in front of a computer, he doesn't want to do that. He's going to med school. So I think it does change, and we all change as people. We evolve, and that's a wonderful thing. So you might try something and have some exposure. I actually double majored. I was a education major and a nursing major because I couldn't decide. And then once I did, I got into my student nursing. I decided I wanted to go down the nursing career, but people change, they evolve, and it's exciting, and there's lots of opportunities. I guess the biggest thing I would say is don't let anything limit you. You have the option to do whatever you choose to do, and that will change as you change, and that's a great thing. So anyway, I started as a CNA and ended up, doing the nursing career, and very happy I did.
So I liked what Dr. Gonzalez said about when working with adolescents, and people are, when you're at the age that middle school and high school, it's hard to think about 2 years and 4 years and 6 years, but the reality is those years fly by, and you can either spend your time going to school, and all of a sudden you look back and it's over with, and that time would have gone by either way.
Right.
It's hard to think about that, but that's what I had to keep telling myself is, you know what, 4 years is going to go by either way. So I could either keep going to school, and you will never regret it. You won't regret it.
Yeah.
I'd also like to add additional thing is that with school, it doesn't have to be all at once, right? And so, you can do it where, like, after undergraduate, I'd worked for a number of years before going back to school. And there's also options where you can go to school part-time.
Right.
And I mean, a lot of times there's just continuing education, professional learning and development. So if you say you hate school, I'm sorry to break it to you, but there's a lot of different opportunities to continue to learn. And that's one of the ways that you can grow.
Good point. To add to that, I had my bachelor's degree, and then the position I was in was going to require a master's, and I was dreading it. But I started taking just one class at a time, and all of a sudden it was over.
Right.
And so it's pretty exciting. And I tell people, if I can do it, anyone can do it. So I would just encourage any of you considering it, just do it and keep on plugging away. Even undergrad, there's so many options and so many things you can do to get through school. It's work, but it's worth it.
Right.
I can tell you from my experience, I graduated with my undergraduate and master's back to back. And then I went and got a job at a university teaching at a undergraduate level. So I was so proud. Here I am. And then I immediately realized, wow, I want to go on and get my doctorate, but I wanted to go into medicine and I needed to have certain prereqs. So while I taught at that community college, I took the classes at the community college to get my prereqs. The chemistry teacher was very kind because a lot of the students were in my class that I was in class with. And so they would let me do my labs by myself. Because I had someone slip me a note going, what did I get on that quiz grade? And I was like, oh, awkward. But it was humbling. It was, but I sat there and I worked every day and got the classes I needed before I applied for my doctorate. And I'm very glad to do that. I was a little bit older than the traditional student when I went and got my doctorate, but I wouldn't change that because I had that experience out and working, and I was so appreciative to be back in school and be in that environment. So like I said, don't let anything stop you from that, even if it is having to take classes with your students, which was weird. So.
Another student question that we had is, what do I do if I don't know what I want to do?
It's okay. You don't have to know what you want to do. Oh my gosh. Half of my residents that I train now don't know what they want to end up doing in their residency. They don't know what kind of radiologist they want to be. So like I keep saying, my field didn't even exist. It's okay. Go out there and experience as many things as you can. Get a wide variety. I started out in one area, and then in my undergraduate just took one class in physical anthropology, and that's what started me on this whole career. It was just one of those classes that I needed to graduate, and so I thought I would go take it, and it was close to anatomy, and so I figured I'd never hear of it ever again, and that changed my life. So take everything.
Summer, what kind of things were you interested in when you were in high school?
Believe it or not, I actually was a music major when I started college. I play the harp, and so everyone at my school knew I was going to go and be in the symphony somewhere. And I quietly read a lot and was very interested still in computers and anatomy. And so I figured if the music degree would allow me to take outside classes, so I came to University of Nevada, Las Vegas as a harpist. Started in the symphony, I played in the Nevada Symphony, and I just quietly would take the science classes behind it. And that is how I transitioned to what I do. And so I still play the harp, I still have my harp, but nobody could take that away from me. That's a skill set. I didn't need to have a degree in it, but to be in medicine, you have to have a degree. So yeah, I was interested in music, and that's what I did in high school.
If you don't know what you want to do, you are not alone. There are many like you. I was one of you, right? I still don't know what I want to do. I mean, honestly, next. So I would recommend talking to people, doing informational interviews, ask what they did. If you're interested in certain elements, tell people that, because they could actually make some suggestions of different ideas, and also just try something. I mean, this is where, we've been mentioning that, paths aren't necessarily linear, right? You kind of learn from your experiences. So try something, see what you like and don't like, and talk to more people to try to figure out what you want to do next.
One thing I took advantage of is when I was in college, there's a lot of hospitals that actually have volunteer opportunities within the medical field. That you have to have a little bit of a training, maybe like a few weeks or so, but I was able to see surgeries as an anesthesia, helper and all that stuff. So that's available, and it'll help you also figure out kind of like where to go, left, right, or, keep exploring.
Very good point.
Yeah.
Okay. I would like to thank all of our panelists for joining us today. So thank you for spending time with us. And we are hoping that the students were able to hear about a career they never knew existed before, and hope they are inspired by all of you. So with that, I'll turn it back to Vicki.
Thanks, Sue, and thank you to all of our panelists for a wonderful discussion. This was some really exciting careers and unique careers in this group, so thank you all for your time. Students, make sure you tune in next week for our panel on advanced manufacturing and careers in technology. If you'd like to submit a question to one of those panelists, then please connect with your teacher and get the link to submit that question. So from all of us at Career Connect Southwest, thanks everyone for their time, and we hope to see you next week on our next virtual career panel.